Unveiling complexity. Schizoaffective disorder and schizophrenia. Schizoaffective disorder and schizophrenia are distinct mental health conditions with overlapping features. This often leads to confusion in diagnosis and treatment. We will delve into the intricacies of each condition, examining their unique characteristics, diagnostic criteria, and treatment approaches. Schizoaffective disorder and schizophrenia are characterized by symptoms like hallucinations, delusions, disorganized thinking, and emotional disturbances. However, the manifestation and duration of these symptoms differ significantly between the two disorders. This analysis will highlight these crucial distinctions, equipping mental health professionals with the knowledge to make accurate diagnoses. Effective treatment plans are essential for managing these complex disorders. Navigating the Labyrinth, a guide for mental health professionals. This analysis serves as a guide for mental health professionals navigating the complexities of schizoaffective disorder and schizophrenia. We will discuss the importance of comprehensive assessment, including clinical interviews, psychological testing, and collaboration with other healthcare providers. Understanding the nuances of each disorder is crucial for developing individualized treatment plans. We will explore evidence-based interventions, including pharmacological treatments and psychotherapeutic approaches. Addressing social, occupational, and functional challenges is essential for improving overall quality of life. Ethical considerations such as informed consent and confidentiality are also crucial in treatment. Promoting a compassionate and ethical approach ensures the well-being and autonomy of patients. By understanding these complexities, mental health professionals can provide better care. Defining schizoaffective disorder. Schizoaffective disorder combines elements of schizophrenia and mood disorders like depression or bipolar disorder. According to the DSM-5, it is diagnosed when a person experiences a major mood episode concurrent with at least 2 weeks of psychotic symptoms in the absence of mood symptoms. This dual presentation makes it challenging to diagnose and treat. The distinction lies in the prominence and persistence of mood symptoms. Unlike schizophrenia, where mood symptoms might be present but not dominant, schizoaffective disorder features substantial and pervasive mood disturbances. This can lead to significant challenges in daily functioning and quality of life. Understanding the underlying neurobiology is crucial for developing effective treatment strategies. Research shows unique patterns of brain abnormalities in individuals with schizoaffective disorder. These include reduced gray matter volume in specific brain regions, explaining some cognitive and emotional difficulties. In summary, schizoaffective disorder is characterized by a blend of psychotic and mood symptoms. This dual diagnosis requires careful consideration by mental health professionals. Accurate diagnosis and effective treatment are essential for managing this complex disorder. Symptoms and diagnosis. The symptoms of schizoaffective disorder can be diverse and complex, making diagnosis challenging. Key symptoms include hallucinations, delusions, disorganized thinking, and significant mood disturbances. Mood disturbances can manifest as major depressive episodes or manic episodes. To diagnose schizoaffective disorder, clinicians must identify a period during which both psychotic and mood symptoms are present. This differentiates it from conditions like schizophrenia, where mood symptoms are not as prominent. The diagnostic process involves a comprehensive clinical interview, detailed patient history, and collaboration with family members or other healthcare providers. One primary challenge is distinguishing it from bipolar disorder with psychotic features or major depressive disorder with psychotic features. The key difference lies in the timing and duration of psychotic symptoms relative to mood symptoms. In schizoaffective disorder, psychotic symptoms must occur independently of mood episodes for at least 2 weeks. Accurate diagnosis informs the treatment approach. Misdiagnosis can lead to inappropriate treatment strategies. A thorough diagnostic process is essential for providing the best care. Schizoaffective disorder affects about 0.3% of the population, according to NAMI. It is diagnosed more frequently in women, with symptoms typically appearing in early adulthood.
The onset of symptoms can be gradual or sudden, and the course of the disorder can vary widely.
Real-world case studies provide valuable insights into the lived experiences of those with schizoaffective disorder. Consider Jane, a 27-year-old woman who initially presented with symptoms of major depression.
Over time, I began to experience auditory hallucinations and delusions, leading to a diagnosis of schizoaffective disorder, depressive type. My case underscores the importance of monitoring both mood and psychotic symptoms.
Another case study involves Mark, a 32-year-old man with signs of mania and paranoid delusions. Mark's symptoms were initially mistaken for bipolar disorder with psychotic features. However, his psychotic symptoms persisted even when his mood was stable, leading to a revised diagnosis of schizoaffective disorder, bipolar type.
These case studies highlight the complexity of schizoaffective disorder and the necessity for ongoing assessment and adjustment of treatment plans. Understanding the unique presentation of each individual helps mental health professionals provide more tailored and effective care.
Schizophrenia is a chronic and severe mental illness that profoundly impacts perception, thoughts, emotions, and behaviors. It disrupts normal brain functioning, leading to symptoms that impair daily life. Understanding this disorder is crucial for effective treatment and support. Symptoms include hallucinations, delusions, and disorganized thinking. The impact extends to families and communities, creating significant challenges. Addressing all symptoms is vital for improving well-being and quality of life. Schizophrenia's symptoms are categorized into three domains: positive, negative, and cognitive. Positive symptoms involve an excess or distortion of normal functions such as auditory hallucinations and delusions. These positive symptoms can be very distressing, leading to fear, anxiety, and social withdrawal. Negative symptoms represent a decrease or absence of normal emotional and behavioral responses. Alogia, characterized by reduced speech output, is a common negative symptom. Individuals with alogia may struggle to find words or speak in a monotone voice, lacking emotional inflection. This can make it difficult for them to engage in conversations and build meaningful connections. Cognitive symptoms affect thinking and information processing abilities. These include difficulties with attention, memory, and executive functions like planning and problem solving. These cognitive impairments can significantly impact daily life, making it challenging to learn new information or manage everyday tasks. The interplay of positive, negative, and cognitive symptoms creates a complex presentation. It is essential for mental health professionals to conduct a thorough assessment of each symptom domain. Developing a comprehensive and individualized treatment plan tailored to the individual's specific needs is crucial. According to the World Health Organization, schizophrenia affects approximately 20 million people worldwide. This disorder typically emerges in late adolescence or early adulthood.
Early onset can disrupt education, employment, and relationships. Early detection and intervention are paramount. Delays in diagnosis are common due to gradual symptoms and stigma. Raising awareness and promoting early help-seeking behaviors are crucial.
Schizoaffective disorder and schizophrenia share many overlapping symptoms, making differentiation complex. Both conditions can manifest with symptoms like hallucinations, delusions, and disorganized thinking. The key distinction lies in the presence and prominence of mood symptoms in schizoaffective disorder. Schizoaffective disorder is characterized by significant mood disturbances alongside psychosis. Understanding these distinctions is crucial for accurate diagnosis and treatment. Diagnosing schizoaffective disorder versus schizophrenia is challenging due to overlapping symptoms. The DSM-5 requires a major mood episode with active phase schizophrenia symptoms for schizoaffective disorder. Symptoms evolve, making accurate diagnosis and longitudinal assessments crucial. Differential diagnosis is essential to rule out similar conditions like bipolar disorder with psychotic features. Comprehensive interviews and collaboration with healthcare providers are vital for accurate diagnosis. Section 3. Treatment approaches and outcomes. Schizoaffective disorder and schizophrenia treatments differ due to mood symptoms in schizoaffective disorder. Antipsychotics are key for both, but schizoaffective disorder needs mood stabilizers or antidepressants. This dual approach addresses both psychotic and mood disturbances. CBT and other therapies improve coping strategies. Schizophrenia treatment focuses on antipsychotics like haloperidol and risperidone. Negative and cognitive symptoms need additional therapies. Outcomes vary based on symptom severity, treatment adherence, and support networks. Section 4. Case studies and clinical implications. Examining real-world case studies helps illustrate the complexities of schizoaffective disorder and schizophrenia. These case studies offer valuable insights into the diagnostic process and treatment strategies. Consider the case of Lisa, initially diagnosed with schizophrenia, later revised to schizoaffective disorder. This highlights the importance of ongoing assessment and adjusting treatment plans. Another case is Michael, diagnosed with schizophrenia, showing persistent symptoms despite treatment. Michael's case underscores the need for a multifaceted treatment approach. Clinically, these cases emphasize personalized treatment plans and comprehensive care. Section 1. Pharmacological interventions targeting symptoms at their root. Effective treatment for schizoaffective disorder and schizophrenia often necessitates a multifaceted approach, with pharmacological interventions playing a crucial role in managing symptoms and improving overall functioning. Antipsychotic medications are considered the first-line treatment for both disorders, aiming to alleviate the debilitating effects of psychosis. For individuals with schizophrenia, antipsychotic medications are primarily used to target positive symptoms such as hallucinations, delusions, and disorganized thinking. These medications work by modulating dopamine activity in the brain, a neurotransmitter implicated in the development of psychotic symptoms. First-generation antipsychotics, such as haloperidol and chlorpromazine, have been used for decades and can be effective in reducing positive symptoms. Second-generation antipsychotics, including risperidone, olanzapine, and quetiapine, are often preferred due to their lower risk of certain side effects, such as movement disorders. These newer medications also target serotonin receptors in the brain, which may contribute to their broader efficacy profile in managing both positive and negative symptoms. The choice of antipsychotic medication should be individualized based on factors such as the patient's symptom profile, medical history, potential side effect risks, and personal preferences. Close monitoring by a healthcare professional is crucial to assess treatment response, manage side effects, and make adjustments to the medication regimen as needed. Empowering patients through therapy. Psychotherapeutic approaches empower individuals with schizoaffective disorder and schizophrenia to cope with their illness and improve their quality of life. Cognitive behavioral therapy, or CBT, is a widely recognized therapy for psychosis. Individuals learn to recognize early warning signs of relapse and develop coping strategies. Family therapy provides essential support and improves treatment adherence. Social skills training focuses on improving social interaction and communication skills. Section 3. Holistic care, integrating support systems for long-term well-being. Treating schizoaffective disorder and schizophrenia requires a holistic approach beyond medication and therapy. Integrating comprehensive support systems is crucial for long-term well-being. Supported employment programs help individuals find and maintain meaningful employment. Employment fosters financial independence, self-esteem, and social connection. Housing assistance programs offer varying levels of support for independent living. Stable housing reduces stress and provides a sense of security. Case management coordinates care and connects individuals with resources. A holistic approach empowers individuals to manage symptoms and live fulfilling lives. Prognosis and long-term outcomes. Prognosis for schizoaffective disorder and schizophrenia varies, influenced by symptom profile, age of onset, and access to treatment. Both disorders require lifelong management, but appropriate treatment can lead to symptom remission and improved functioning. Studies suggest schizoaffective disorder has a slightly better long-term prognosis than schizophrenia. Early intervention is critical for improving long-term outcomes. Early treatment during first episode psychosis improves outcomes. Ongoing research offers hope for more effective treatments. Section 2. Confronting barriers, stigma, treatment adherence, and holistic care. Despite advances, stigma and treatment adherence remain significant challenges in managing schizoaffective disorder and schizophrenia. Stigma prevents timely help and access to support services. Treatment adherence is hindered by medication side effects and cognitive impairments. A multifaceted approach including holistic, person-centered care is essential. Embracing holistic care empowers individuals to live fulfilling lives. Bridging the gap from understanding to action. Moving beyond theoretical knowledge to meaningful action is essential. These disorders need evidence-based treatments, compassionate care, and ongoing support. Bridging research and clinical practice improves lives. Accurate differentiation and individualized treatment plans are crucial. Section 2. A call for compassion, collaboration, and continued progress. Despite significant advances in our understanding and treatment of schizoaffective disorder and schizophrenia, substantial work remains to be done. Stigma continues to cast a long shadow on these disorders, preventing individuals from seeking timely help and perpetuating misconceptions that fuel fear and discrimination. As mental health professionals, we have a moral imperative to combat stigma through education, advocacy, and by treating all individuals with respect and dignity. Collaboration among healthcare providers, researchers, policymakers, individuals with lived experience, and their families is essential for driving progress in the field. Sharing knowledge, resources, and perspectives will lead to more effective treatments, improved support services, and ultimately a brighter future for those living with these disorders. Continued research is paramount for deepening our understanding of the biological, genetic, and environmental factors that contribute to schizoaffective disorder and schizophrenia. Investing in research will lead to the development of more targeted and effective treatments, potentially even a cure, offering hope for a future where these disorders no longer cast a shadow on the lives of millions. As we move forward, let us embrace compassion, collaboration, and an unwavering commitment to improving the lives of individuals with schizoaffective disorder and schizophrenia. By working together, we can break down barriers, promote understanding, and ensure that everyone affected by these disorders receives the care, support, and opportunities they deserve to live full and meaningful lives.